Good afternoon. My name is Susan Lindauer, and I'm the Executive Director with the Children's Trust Fund of Oregon. I want to acknowledge our board members that are here with us today, Mary Steinberg and Senator Thompson. The Children's Trust Fund was formed in 1985 by the state of Oregon to provide leadership around child abuse prevention. And it is the only organization in Oregon that's focused on the prevention of child abuse. I want to really quickly introduce Representative Jean Wisnett to talk about the proclamation that just passed a few minutes ago. So, Representative Wisnett.
Thank you, Susan. I'm State Representative Jean Wisnett from Sun River. And as I stated on the floor today, the resolution passed 60-0. But it's really sad that we have to have a resolution asking people to be aware of this tragedy in our society. But we do have too many children, and 80% of those children are abused or neglected by those reports come from by their parents. So it's real important. One of the things that I've worked on and the Children's Trust Foundation continues to work on is parenting classes. We need to make parents aware they're facing a lot of stress, and that's where we get a lot of the child abuse, as I said, from 80%. That's unacceptable, so we need to continue to work on that. That was what the resolution was about, making people aware of this. And I cannot not speak about one of the ways everyone in Oregon can help is by buying our Keep Kids Safe license plate, which we passed last session. And Susan and her team have been a great supporter of that. Everyone can buy that plate, and the funds will go to help child abuse prevention programs. So thank you very much, and I'll turn it over to the board members and to Susan and the doctor to tell you how serious and tragic this child abuse is in Oregon and the United States. Thank you.
Okay, I just want to acknowledge Representative Brent Barton behind me as a board member of the Children's Trust Fund of Oregon as well. So why are we gathered here today? I think we all care about the well-being and educational success and health of our children in Oregon. There were 74,000 reports of child abuse and neglect last year, and there were 11,600 victims of abuse and neglect last year. That's one too many, and we must do something about this. As you know, childhood trauma and abuse takes an incredible toll on our children, families, and communities, and in terms of negatively impacting their educational readiness and success, their poor health outcomes, and a host of other issues, including mental health, special education needs, and these can lead to teen pregnancies, youth homelessness, and being at risk for juvenile justice. There's also a significant cost to our society in terms of kids that are having to go into child protective services, child welfare, and foster care. We estimate, there's estimates that this costs annually of $2.5 billion. Luckily, there are solutions to this, and we're really excited to release the report Preserving Childhood that identifies best practice evidence-based programs that are solutions to some of these horrific issues. So I'm really excited to introduce Senator Chuck Thompson, who's a new board member of the Children's Trust Fund, who's going to talk a little bit about the tragedy of child abuse and the burden and the cost of child abuse in our state. So, Senator Thompson.
Thanks. Good afternoon. My name's Chuck Thompson, State Senator, District 26, which covers Hood River County, pieces of Multnomah and Clackamas County. I was a county commissioner in Hood River for 16 years. We have a small child abuse center there. I really didn't become aware of the magnitude of this issue until I came to Salem and attended a few meetings and got to know Clackamas County and Multnomah County and what they do in those counties. It's an amazing process. The trouble is there's just not enough dollars put to those kind of programs. The little program we have in Hood River really struggles each year to get funding. I'm really impressed with what Clackamas County has done with their works, and also Multnomah County. I just wish it's just not state and county funding that we rely on. We rely on a lot of community people, volunteers helping in there, but we really do need to put some more dollars into those, and this trust group is helping us do that. I just wanted to go over a few of the kind of statistics and get everybody a little bit of idea how this impacts the state of Oregon and the children of Oregon. In 2011, there were almost 11,600 confirmed victims of abuse and neglect in Oregon. 74,000 reports of suspected abuse were received in the same year. Half of confirmed victims of abuse in Oregon are young children under the age of 7. Younger children are often more vulnerable to abuse and neglect. More than 80% of confirmed cases of abuse are caused by parents. The burden of child abuse. Calculating the economic impact of child abuse for children, families, and Oregonians includes multiple layers of services, including foster care, juvenile, crime, and prison, child welfare, mental health, special education, and adult health care. It is estimated that each confirmed case of child abuse and neglect costs our communities and our state a minimum of $210,000 over the course of a child's lifetime. Based on this estimate, Oregon will pay nearly $2.5 billion for the care of the state's 2011 child abuse victims alone. And at this time, I would like to introduce Dan Leonhardt, as chair of the PCA of Oregon, child abuse specialist at CARES Northwest and at Randall's Children's Hospital. Dan?
Thank you.
You bet.
Thanks. So the information that we've just heard regarding the prevalence of child abuse is really alarming and overwhelming. Child abuse remains the greatest public health problem for our nation's children and for Oregon's children. As healthcare providers who care for children, as elected public officials, as community members, as neighbors, and as parents, we all have the responsibility to ensure that all of Oregon's children grow up in safe and nurturing environments. But amid all the numbers that we've heard, there is some good news. First, child abuse can be prevented. Research has shown that there are prevention programs and strategies that can effectively reduce the risk factors for child abuse and neglect. Families can be strengthened, home environments can be transformed, children's lives can be saved. Second, there already exist proven and promising child abuse prevention programs right here in Oregon. The Preserving Childhood Report highlights these nationally recognized, research-driven, best practice prevention programs and parenting curricula that are currently serving Oregon's families, both statewide and in select communities. And at the same time, the report recognizes programs that are promising for their potential to reduce child abuse, but as of yet have limited evaluation data. Many of the programs that have shown to be effective in child abuse prevention have common elements. Home visitation, for example. Home visits by trained professionals who focus on nurturing healthy child development by promoting, reinforcing, and role modeling positive parental practices. Parent education. Education can occur through classes, individual training, or media, such as written pamphlets or DVDs. Curricula may focus on teaching parents about normal child development or may focus on improving specific parenting skills. Group support. Peer support can reduce isolation that many parents experience. Parents can learn, teach, and support each other as peers. And case management. Individualized case management helps assist parents to find the needed resources and support to help deal with issues that may increase stress or risk of child abuse in a home environment, such as domestic violence, economic hardship, drug and alcohol use, and lack of adequate child care. Some of the programs that are highlighted in the Preserving Childhood Report use one specific strategy, such as parental education, while others use a combination of these elements to effectively provide parents with the tools they need to be successful. While the Preserving Childhood Report highlights 12 abuse prevention programs that have the ability to significantly reduce the incidence of child abuse and neglect in Oregon, the report also emphasizes that these programs need the proper funding and support to be successful. Unfortunately, there are counties in Oregon where access to the programs that have been shown to be most effective is limited. In counties where these programs are available, inadequate public and private funding limit access to only a small percentage of the families who would benefit from these programs and services. As a physician, I would compare this problem to the treatment of a potentially life-threatening medical issue. A medication may exist that provides the guarantee of a complete cure. However, if not used in the proper dosage or strength needed, the medication may have only limited efficacy, or in some cases it may not work at all. It becomes critical in this climate of limited resources that communities and service providers choose well when deciding how to implement child abuse prevention programs. The Preserving Childhood Report has chosen to highlight the programs which represent best practice in child abuse prevention to help aid communities in utilizing strategies which have already been shown to be effective. These programs and report represent our shared commitment that all children and families should have bright and hopeful futures. I'm now pleased to introduce Angela Holt, who is a representative of the Cambia Foundation.
Thank you, Dr. Landhart, and thank you all for your time this afternoon. Cambia Health Foundation sponsored the Preserving Childhood Report as part of our recently expanded funding commitment to the health and well-being of children throughout our region. Child abuse and neglect has a profound and long-lasting impact on overall physical and mental health. In fact, as noted today, research shows a strong link between early childhood trauma and costly adult health issues, including cancer, heart disease, and diabetes. As Dr. Landhart outlined today, the Preserving Childhood Report not only shines a light on the horrific impact of child abuse, but provides important recommendations regarding evidence-based programs and initiatives that can help strengthen child abuse prevention efforts throughout our state. We have proven effective programs in our state today that provide a foundation for a more robust effort around child abuse prevention. However, large-scale change requires broad, cross-sector coordination, not the singular intervention of individual organizations. We need collaboration in both the public and private sector and among funders. Our hope as a foundation is that the report released today will encourage discussion and dialogue and collaboration, and that as a community and as a state, we work together on this very important issue. Thank you so much.
Now privileged to introduce Representative Carolyn Tomei, who's actually represents my district, and share a little bit about her perspectives and in terms of a public-private partnership. So, Representative Tomei.
Thank you very much. I am Carolyn Tomei. I represent House District 41, which is Milwaukee, Oak Grove, and parts of southeast Portland. As chair of the Human Services Committee, I see many instances of public and private partnerships achieving great success. In order to combat large social problems, and certainly child abuse is one of the worst, we must realize that it will take a community-wide response. Supporting the healthy development of our children is the responsibility of all of us. Indeed, it takes a whole community to raise a child. The Children's Trust Fund of Oregon partners with the Department of Human Services in efforts to foster care and child welfare caseloads. The Department of Human Services does a great job with what they have, but they rely on partnerships with nonprofit organizations and with private entities to bolster their capacity. Oregon needs to maintain a strong continuum of support for all parents at various levels of their stress so that they can find the resources and the support they need. It's critical that we intervene early before situations really start to deteriorate. If a child receives community support when he or she is young, they have a very good chance of avoiding the negative effects of abuse, a poor performance in school, of mental and emotional disorders, and social difficulties later in life. I want to commend the Children's Trust Fund of Oregon for serving as a resource and for coordinating childhood prevention strategies throughout our state. The Trust Fund is a funding partner with 34 abuse prevention agencies across Oregon. They work to leverage private support from across Oregon with nearly 10,000 donors every year through tax credit checkoffs, through workplace giving, and other corporate and individual support. The Children's Trust Fund has a nearly 30-year history of expertise, coordination, and fundraising to support service providers, funders, and policymakers. I hope that we can continue our partnership with the Children's Trust Fund in the future, and I can hope that we all remember on our income tax return to do the charitable tax checkoff this season. Thank you, and remember to send in your income tax and do the tax checkoff. Thank you.
Thank you so much, Representative Tomei. I'm honored to have with us an executive director from a relief nursery that serves the Marion and Polk counties, Family Building Blocks, and Patrice Altenhofer will be presenting, and then she'll introduce one of her former parents, Jamie Glinsky, and the services that she received and benefited from. So Patrice and Jamie, please join us, and thank you so much for being here.
Hi, my name's Patrice Altenhofen, and I'm the Executive Director of Family Building Blocks here in Salem, Oregon. I want to thank everyone especially Susan, for inviting me here today, and I want to thank the Cambia Foundation for their wonderful report. It's just very encouraging to see someone really take a close look at the work you're doing and tell you are being successful. So my staff and I very much appreciate that work. So Family Building Blocks is one of those public-private partnerships that we can really point to as a success story for the prevention of child abuse in Marion and Polk counties. We truly are a child abuse prevention program, which really means we are a family strengthening program. Our mission is to keep children safe and families together. And we work with families that have young children under the age of 6 who are struggling with lots of challenges: poverty, unstable housing, domestic violence, depression, minimal education, a history of abuse, the list goes on. We call these risk factors, and the families we serve average about 15 of them. And in light of these enormous challenges, it is remarkable that 99% of the over 1,100 children we served last year were able to continue living safely together with their parents. Almost all the families that come to our programs are with us voluntarily. They want to give their children a better beginning than perhaps they had, and they want to break the intergenerational cycle of abuse. Imagine the courage it takes for a parent to come forward and say, "I need your help. I want to be a better parent." They come to us for this help because they trust us, and we hold that trust very dear. So how do we help? Well, first we help children thrive. During the first few years of a child's life, the architecture of the brain is developing, which will shape the course of their entire lives. The most rapid period of growth is in early childhood, and by age 3, 80% of the child's brain is developed, which is why these early experiences are so important for the children we serve. When it comes to brain circuitry, it's better to get it right the first time than to try to fix it later. When we talk about healthy development in the early years, particularly when we talk about preparing children to succeed in school, we cannot separate cognitive development from social and emotional development. You cannot have one without the other. So we provide therapeutic classrooms to give infants, toddlers, and preschoolers a safe place to practice self-control, learn how to make friends, and to gain the skills that will shape their brains so they are successful in school. Home visitors design appropriate activities to help parents stimulate their children's brains, advance their literacy, and to make learning fun. Next, we support parents. Responding to a parent's call for help is the primary key to preventing negative outcomes for children. Family Building Blocks teachers and home visitors coach parents to become their child's first teachers and to help guide them to create a stable and nurturing environment in which their children can grow. When a parent opens their door and invites us into their homes, we know they are ready for our help. We also provide parents with referrals to community resources and also offer classes that focus on parenting skills, enabling a parent to recognize and respond appropriately to their child's care and needs. And finally, we strengthen families. As we increase the family's ability to cope with life's challenges, Family Building Blocks is strengthening the parent-child relationship. Home visitors encourage families to read stories and play together to nurture their child's development and increase the parent-child bond. Social experiences are key in helping children learn about their environment, to develop trust and be exposed to the culture and language of their world. Playgroups and family nights allow parents and children to interact with other families in a social setting. We partner with parents to promote healthy child development through the effective management of stress with the goal of family self-sufficiency. And with that, I'm just so proud to introduce Jamie Galinsky, who's here to help tell her story about her experience with family building blocks.
Thank you, Patrice. And just one minor note, my last name is Hamilton.
Is it?
Yes. Galinsky is my maiden name. Thank you very much for allowing me to come and share a little bit about my success as a parent in building a strong family in this community. Just a little bit of background to start off with. I come from a very large family. I'm the oldest of 7 children. We were bounced back and forth between 2 different households. There was not a lot of consistency. There was a lot of emotional abuse, physical abuse, a lot of verbal abuse. And at the age of 3, I was being sexually molested by a family member. And even at 3, I realized that there was definitely something better out there, because I still chose to stay with that family member, even though that was occurring, instead of being home with either set of my parents. So I really did not have a great example of what a normal, healthy childhood should look like. I became pregnant with my daughter, and soon after she was born, I became a single mother and was very, very lost. Thankfully enough, though, I found family building blocks during my pregnancy, and they were able to help lead me in the right direction. They not only helped provide clothing, food, and made sure that all of our physical needs were met and that we were safe, but they also taught me how to take care of my daughter, how to nurture and encourage her for positive growth, things that should be concerning, things, that I should be celebrating, milestones that she was hitting, and just the joy of being a parent, which was something that I never saw as a child. They taught me alternative parenting skills, and I say alternative because they were different from the parenting skills that I was previously taught. I was raised with hitting, yelling, several forms of abuse, things being thrown at you when, you did not do what you were asked to do. And family building blocks helped show me that there is something else better out there, that I did not have to be that parent that I so desperately did not want to be, that I can talk with my children, that they are intelligent beings, and that, together we can create, a different situation for them. They also provided, parenting classes for me to be able to encourage the skills that I was learning and get, feedback from other parents. They showed me how to develop my own support system with people that I trusted, people that cared about my babies as much as I did. Goal setting. They showed me how important it was to, set goals, and that it was okay to make mistakes. Not all of those goals were met in the times that the time frames that we had set aside, but we were still moving forward, and it was still a positive, great experience for me and my children. My children received classroom services. They both blossomed in classroom services. Madison was so prepared for kindergarten. We graduated from the program in 2011. Something else that very important that I feel that family building blocks taught me is my importance, not just as my children's mother, but as a woman, as an active participant in this community, that I am important, and that what I do and say is just as important as anyone else. And then just because of everything that they have given to us, and the strength that they've shown and encouragement in me that I didn't see when they started instilling that in me, is to be able to advocate not only for family building blocks, but to advocate for myself, for my children, for my family, and stand up for what I know is right. And this program is right. Thank you.
Thank you so much, Jamie and Patrice. And Jamie, thank you for your courage and for sharing that incredible story and really demonstrating why these programs are so essential for our families across the state, to give them the support and the strength and really the empowerment to be the best parents that they can be. So, and thank you all to all of our presenters, Cambia Health Foundation, Dr. Leonhardt, Senator Thompson, Patrice, and Jamie. At this time, we can take questions if there are any questions, and we just thank you so much for allowing us this opportunity.
I have a couple of quick questions. One is there a specific request for, since the legislature is in the throes of making its spending decisions now for the next 2 years, is there a specific request to augment what the state's already doing for in the areas of child abuse and neglect? So
we don't have a specific request in during this session. We are very much supportive of the governor's budget that increases support for relief nurseries and the Healthy Start Healthy Families America model that are two of these evidence-based programs.
The other question is probably a little more philosophical, but nobody I know, and I think I would hope anybody knows, is for child abuse. But what is the right balance between parental responsibility in this area and government support?
Dr. Leonhardt, do you have a response to that?
Maybe repeat that. What's the right balance between parental
Parents obviously have responsibilities, given that, of course, your report found that, as I heard, 80% of these reports basically are traced to bad parents.
Yeah. And I think that I think that what we need to do as a community is to make sure every parent has the proper tools to be a successful parent. Many of the parents I encounter, and when I'm encountering a family, it's already at a point where child abuse concern has been raised. And many of these parents have never been raised in environments that are nurturing. They've never had role models as parents, as neighbors, as other relatives to show them how to parent effectively. Many are thrown into parenthood at an early age. And so, it's almost, I think probably when you, and you didn't, I know you didn't mean it in a negative way when you say bad parents, but, you can see probably some of us kind of, because a lot of times I leave a room and I think, why, but kind of for the grace of God, I would be there. Why do we think this child would be in a different place based on what resources and skills these parents had to begin with, which may have absolutely nothing to do with choices, and certainly parents are responsible for choices they make, but sometimes those choices are based on choices that were not made for them and have been years in the making of choices not made. And I think our speaker really, she's highlighted a great success story, but I also talked about some of the background obstacles she was up against, and there are, unfortunately, as the numbers say, just as a lot of parents who unfortunately haven't been able to get where she's at now, and we want to change that. We want to shift that. So is that? Yeah. So, I think that government clearly has, not government, we have. We have, we have a community responsibility for this. Not just, they're our kids. That's how we should focus. It doesn't, you don't have to be biological kid to make them our kids. We need to pass on. I have a 3-year-old son. I want to pass on a better society for him. And it's not going to be better society if child abuse and neglect is as prevalent as it is now.
Thank you.
Thank you.
Any further questions? Okay. Thank you, everyone.